same function. Occupy receptor N, occupy receptor M, directly attached and doing the same job. Understand? Clear? So what's the meaning of indirect? Indirect drug. Indirect. Yesterday I explained we having here enzyme. Which enzyme? Acetylcholine esterase. Yeah? Acetylcholine esterase. So acetylcholine esterase, what is the function of this enzyme? This enzyme doing what?
Breakdown.
Yeah, break what? Acetylcholine
Choline.
into acetate and choline. It's a breakdown of acetylcholine. Clear? So if this drug doing what? You can see this drug have nothing to do with acetylcholine, have nothing to do with the receptor. Yeah, this drug just block this. This drug doing what? Just block. If you block this enzyme, now what happened here? This acetylcholine no more breakdown, automatically acetylcholine increase. Yeah, acetylcholine automatically increase because no more breakdown. Acetylcholine stay for longer duration. Yeah, understand? This is the meaning of indirect acting. It's the meaning of indirect acting. The indirect acting two group. If you block the enzyme for short time, it's mean reversible. Okay, it's mean reversible. If you block the enzyme for short time and then again when your function done, the enzyme again free. So if you block the enzyme permanently, irreversible. If you block the enzyme for short time, if you block these drugs, neostigmine, physostigmine, pyridostigmine, rivastigmine, tacrine, galantamine, donepezil, these are indirect acting, but these drugs you can reverse. Yeah, these drugs are reversible indirect acting. How about ecothiopate? The only one. This drug, if bind the enzyme, not leave the enzyme again, irreversible. Irreversible indirect acting. Till here clear? Irreversible. The grouping of drug done, yeah? Pilocarpine, bethanicol, carbachol. Neostigmine, physostigmine, pyridostigmine, rivastigmine, tacrine. These are the indirect acting. These are the indirect acting drugs. Okay, these are the indirect acting drugs. Now I will share the PPT. You can see the uses of these drugs. Okay, I explain the uses now. What are the uses of these drugs? Everyone can see screen?
Yes, sir.
Yes, sir.
Here you see what are the uses of these drugs. Okay, the concept of indirect acting, direct acting done. This picture is very clear here. Direct acting and direct acting. Direct acting directly attached to the receptor. Okay, indirect acting they block the enzyme. Yeah, indirect acting they only going to block the enzyme. Clear? Indirect acting block the enzyme. Direct acting is indirect acting here. Reversible, irreversible. Yeah. So if you block this acetylcholine esterase, so what happened? Acetylcholine level increase. Understand? This is already done. This thing is also done. And what are the action? What's the use of pilocarpine? The first thing, acetylcholine, bethanicol, carbachol, pilocarpine. These three main drugs. One thing keep in mind: acetylcholine is not used. It's not used as drug. You only can see PPT or also can see the whiteboard. Only PPT.
Only PPT,
sir.
sir.
Oh, I think I must share the full screen here. You can now see the board here. Acetylcholine. Sometimes examiner asks question, can you use acetylcholine as drug from outside? As drug, can you give acetylcholine from outside? No, we never use acetylcholine as drug. Okay, clear? Why? Because liver produce pseudocholine esterase. This enzyme present in blood. Okay, so this enzyme doing what? Break that. If you give blood, if you inject acetylcholine, if you eat acetylcholine break down. So it's a useless. Never use acetylcholine, okay, as drug. Understand? So what we use? We use bethanycol. Okay, we use carbachol in place of acetyl. Acetylcholine is not directly used. Okay, bethanycol, carbachol for what use? After surgery. After surgery, the patient having complaint of constipation. Okay. After surgery, the patient having complaint of urinary retention. Urinary retention after surgery. Okay. So for that purpose, you can use bethanycol. So bethanycol doing what? Bethanycol stimulate M3. Okay. Bethanycol stimulate M3. It's a post surgery. The patient done. Patient just now having like open abdomen surgery. After surgery, any type of surgery, the patient mostly not passing stool quickly, maybe 2-3 days, having complaint of constipation. Okay, to increase the activity of the post surgery patient having constipation, post surgery patient having urine retention. Okay, if bladder is not working, intestine not working, you can give bethanycol, carbachol, both are okay. Understand? So M3 doing what? Increase peristalsis. M3 doing what? Increase bladder contraction. It's a one use. Clear or not? It's a common use. Yeah. The word we use here, atonic bladder. What's mean atonic bladder? Mean no contraction. Atonic bladder. Atonic intestine. Atonic intestine. Mean no contraction of bladder, no contraction of intestine. If intestine, no peristalsis there. Okay. If like bladder, no contraction, no urination, no micturition there. So we can use bethanycol and carbachol to for what purpose? For M3 receptor, stimulate M3 receptor, bladder contraction there, micturition there. Okay. The post surgery patient have this complaint. Post surgery patient have this complaint, atonic bladder and atonic intestine. Okay, intestine, the function, the peristalsis decrease after surgery, the bladder contraction decrease after surgery. Okay, the one very important disease, Chagas disease, may you know Chagas disease. Chagas disease. In Chagas disease, what happened? In Chagas disease, you know physiology of myenteric plexus. What is this myenteric plexus? Myenteric plexus responsible for peristalsis. Yeah. Myenteric plexus doing what? This is physiology. Myenteric plexus. In Chagas disease, what happened? In Chagas disease, destruction of myenteric plexus. Destruction of myenteric. If myenteric plexus destroyed, so can you continue this peristalsis? Of course not. Clear? So again, that no more peristalsis is there. The function of intestine decrease. You again can apply carbachol, bethanycol, carbachol and bethanycol. Done. Carbachol and bethanycol for Chagas disease. In children, the baby born within 24 hours must pass stool. That stool of baby known as meconium. Stool of baby within 24 hours. The baby after the birth must pass stool within 24 hours. The first stool is known as meconium. If the baby have disease in the large intestine, that disease name, maybe you know this disease, Hirschsprung. Which disease? Hirschsprung disease. What happened in this disease? Hirschsprung disease, absent mesenteric plexus. Absence mesenteric plexus. The mesenteric plexus absent. If mesenteric plexus absent, so peristalsis possible. No more peristalsis. Okay. So again, to increase peristalsis, you can give botanicol and carbachol. The uses of botanicol, carbachol done. First, what are the uses of botanicol, carbachol? If your intestine is not working properly, constipation there. If your bladder not working properly, urinary retention there, you can use botanicol, carbachol. Clear? Botanicol, carbachol use for intestine problem. Okay, understand? In Chagas disease, in Hirschsprung disease. Okay, third drug was pilocarpine. Pilocarpine mostly available in the form of eye drops. Okay, it's only have most common use eye uses. The pilocarpine is very effective drug if someone having emergency glaucoma, like very high pressure inside the eye, too much aqueous humor there. It's the only option to treat the glaucoma in emergency situation. Aqueous humor is very high. If aqueous humor very high, emergency glaucoma, very high pressure, this person, if you not give the drug, this person within 1 day can undergo blindness. Complete disruption of retina. Already explained earlier, yeah? So pilocarpine doing what? Pilocarpine doing meiosis. Pilocarpine doing meiosis. What happened with the meiosis? Angle
Dilation.
become more wider, yeah? Angle become more wide. So what happened with aqueous humor? Aqueous humor absorption increases, yeah? Aqueous humor absorption increases. So in case of like glaucoma, the pilocarpine, we use pilocarpine in the form of eye drops, okay? Another function of pilocarpine we use for, do you know cystic fibrosis? Cystic fibrosis. The cystic fibrosis, this is a disease of sodium channel. Disease of sodium channel, okay? And these babies, a genetic disease, these babies having salty skin. They're having salty skin. If the mother gives the baby, the mother can feel, oh, too much salty skin of the baby. Too much salty skin. Why? The sweat, sweat having salt, the sweat gland, they release sweat. The sweat contains sodium. Okay. So in cystic fibrosis, we do sweat test. Which test? Sweat test. We collect the sweat. This sweat is collected and we need to check the concentration of sodium. Oh, this sodium is very high in that sweat. So how you collect the sweat? Putting some pilocarpine on skin. Put some pilocarpine on skin, yeah? So we having which receptor? M3 receptor on sweat gland. So what have now, when you put pilocarpine, the pilocarpine start, the sweat gland start sweating. Yeah? Too much sweating in that area. So you can collect the sweat easily. You can perform this test. Just to perform the sweat test, we use what? We use pilocarpine. Pilocarpine we use for sweat test. Yes, sweat test we done for cystic fibrosis. To diagnose cystic fibrosis, we use sweat testing. Okay. In the sweat, we need to check sodium concentration. Sodium, very high sodium. Oh, it's a confirm cystic fibrosis. These babies, they're having salty skin. Just to reconfirm, we perform sweat test. For sweat test, we use which drug? Pilocarpine. 2 uses done. Pilocarpine, very important use. emergency glaucoma. Never forget this drug for glaucoma, okay? Very, very gold standard drug for glaucoma, pilocarpine. Okay. Another use of this drug, putting some drop on skin, you can collect the sweat easily. So you can perform sweat test. The sweat test used for cystic fibrosis. So pilocarpine used to diagnose cystic fibrosis. These three drugs done. Pilocarpine done. The Bethanicol done. Carbachol done. Okay. Pilocarpine, very important use. Glaucoma, emergency glaucoma. Best drug for glaucoma. Okay, not forget this sentence. Best drug for glaucoma, pilocarpine. Bethanicol, carbachol we use for atoning of intestine. It means intestine not working. Okay, your bladder not working. No contraction of bladder. One thing must keep in mind: if your bladder having stone, obstruction, oh, patient not able to do pee because having stone inside the bladder. So if you have stone inside the bladder, if any obstruction, in never give Bethanicol carbachol like this. Okay, if intestinal obstruction, never use Bethanicol carbachol. It's very important thing. Okay, if peristalsis is not working, for example, it's the intestine. The intestine, this full intestine, stomach, intestine. If no more peristalsis, to increase peristalsis, you can use drug carbachol Bethanicol. If you have something inside, tumor here, okay, obstruction. If you have obstruction, constipation, have constipation due to obstruction. If you have obstruction, intestinal obstruction, intestinal, this you can learn in surgery, intestinal obstruction, okay. So in case of intestinal obstruction, if you increase peristalsis, what happens? This intestine can rupture. Never use like this, okay? You must first confirm, oh, this constipation may be due to decreased peristalsis. If this constipation, okay, if urinary retention, having some obstruction, then never use Bethanicol carbachol directly, okay? First must confirm this intestinal like constipation, intestinal function is just a functional problem. If physiology problem like no contraction of smooth muscle, contraction of smooth muscle decrease, contraction of smooth muscle in bladder decrease, okay. In case of obstruction, we're not using, okay. Just a problem with atony. Atony means no more contraction of physiology of intestine disturb, okay. Understand? The use of pilocarpine done, Bethanicol done, carbachol done. Next drug, another drug, I not tried the name before, adrophonium, another drug, adrophonium. What is this adrophonium? At neuromuscular junction, what we use? At neuromuscular junction. Acetylcholine. Which receptor? Tell me receptor name.
M3.
NM. Neuromuscular junction, skeletal muscle. Which muscle? You're talking about M3. M3 for?
Smooth muscle.
Okay. On GIT, on RSP, like this. M3. Okay. This acetylcholine here. So what is myasthenia gravis? Everyone know about this disease? In myasthenia gravis, this is the receptor for acetylcholine. Yeah? One antibody come and destroy this receptor. Yeah. So if you destroy the receptor, you have here acetylcholine. Yeah. This acetylcholine, can this acetylcholine, now you can see just few receptor here. For example, you have 10 receptor. You have 10 receptor. Oh, 7 receptor gone. Why gone? Because they're destroyed by antibody. Clear? antibody destroy the receptor of acetylcholine. You just having remaining receptor just three receptor left. So can you perform the same duty? Of course not, yeah, because the receptor decrease now. Receptor decrease now. If you increase acetylcholine here, how you can increase acetylcholine? Do you know enzyme acid? Just now we finished this acetylcholine esterase enzyme. Yeah. If you hold this enzyme, you block this enzyme, so acetylcholine level increase. Acetylcholine stay longer. Acetylcholine, if you not allow this enzyme to break, then acetylcholine stay longer. Yeah, stay for a long time. If stay for a long time, these three receptor, we just can use three receptor and can achieve muscle contraction. Understand? So in myasthenia gravis, we need to increase acetylcholine level. Okay, how we can increase? Block this enzyme. How we can increase? Block this enzyme. Done. For myasthenia gravis, for myasthenia, to diagnose myasthenia gravis, we use adrophonium. Adrophonium, must keep in mind, adrophonium not used for treatment. Adrophonium only used to diagnose. Okay, adrophonium only used to diagnose. How patient come to you? Patient have this disease. What complaint? Patient say, oh, hey doctor, I having muscle weakness. Muscle weakness, like the muscle weak. Where muscle weak? First from facial muscle, face muscle, like eye, lid drop easily, eye muscle weak. Yeah. Then upper limb muscle, not perform the duty normally. Yeah. But I feeling weakness in my face muscle. I feeling weakness in upper limb muscle. So this patient may have myasthenia gravis. Yeah, may have myasthenia gravis. So the patient complain muscle weakness. Then you first, what you do, give adrophonium. What you give to patient? Adrophonium. This adrophonium doing what? Inhibit this enzyme. Yeah, acetylcholine increase. Then what happened? Muscle weakness there. Muscle contraction improve. Patient at your clinic now, you just inject adrophonium. Hey, now you feeling better? Yes, now I am feeling better. I am feeling good contraction in my upper limb, in my face muscle. Yeah, it's mean this patient having myasthenia gravis. Is confirmed. Adrophonium. Understand? Adrophonium. And this test name is, keep in mind, what is Tensilon test? Which test? Tensilon. What is Tensilon test? Nothing. Oh, this is a test to use to diagnose which disease? Myasthenia gravis. How we perform this test? What you give to patient? Adrophonium. What you give to patient? Adrophonium. Then patient, what patient saying? Oh, now I am feeling better. Yeah, it's mean the patient muscle weakness due to myasthenia gravis. Understand? If patient give response to adrophonium, it's mean patient having myasthenia gravis. Okay, now you diagnose the disease. It's a confirm. Yeah, it's a confirm now. What you give to patient? You need to give treatment. What you give to patient? Pyridostigmine. Which drug you use? Must keep in mind pyridostigmine. Pyridostigmine used for myasthenia gravis. Understand? Pyridostigmine used for myasthenia gravis. Clear?
Clear, sir.
Okay. Pyridostigmine we use for myasthenia gravis. Now I give you one task. You guys, tomorrow class, explain this term, cholinergic crisis. What is cholinergic crisis? Number one question. Number two, how we, these two questions for you guys, you must solve. Okay, how we diagnose patient having patient having myasthenia gravis or cholinergic crisis. Okay, both patient having muscle weakness, cholinergic crisis. These are to your homework. Okay, these two questions. Try to solve these two questions. Tomorrow I will ask first this, then we explain further remaining drug. The remaining drug left tacrine, galantamine, just used for Alzheimer's disease. Tomorrow, inshallah, this system will finish and I will start antagonist. Okay.
Okay,
Okay,
sir.
sir.
Because
Okay,
now,
sir.
now
Thank.
I have to getting ready for my clinic. I want to go to, so I have no time to answer your question. If you have any question about today lecture, you can send me message. Okay, no problem.
Okay,
Yes,
okay,
sir.
sir.
I
Thank you
can
so much,
answer
sir,
now.
for today class.
Okay,
Everyone
sir.
understand? Everyone
Yes,
understand about
sir.
the lecture?
Sir.
Pharmacology is not much difficult subject. Just need little concentration and very easy. Just correlate the thing. Okay, it's very easy. Inshallah. Okay, Allah Hafiz.
Allah Hafiz.
Allah Hafiz.
See you
Baik,
tomorrow.
sih.
Allah. Allah.
Iya.
Among Us.
Ayo, bagi itunya. Bagi kode.
Iya, lu bawa main.
Main terus lu aku.
Ayo.
Apa nih?
Bagilah di grup.
Aku kemarin pertama kali main langsung bisa menang loh sebagai imposter.
Enggak, terus Rizky kan diam-diam tuh jadi imposter. Soalnya nggak tahu lagi.
Aku memanfaatkan pura-pura belum ngerti permainannya.
Game fitnah, sumpah.
Yang baru main nanti ku tanya yang namanya warna merah siapa, langsung dituduh.
Tapi main game itu sama video call pakai itu nggak keren, jadi kayak cepet ketahuannya.
Iya.
Soalnya kalau kita sudah kebunuh terus kita kasih kode, oh yang itu loh, masih kasih kode kayak gitu.
Iya. Permainan kambing.
Yang
Seru tuh.
yang saya bukan Oji, sumpah.